Thank you for welcoming me to the stage as well. And now I speak as an aesthetic and regenerative medicine provider. So there is a gap currently in aesthetic medicine, and what that gap equates to is that we as physicians and medical providers, we evaluate our patients for their medical history to find out any contraindications they may have. But we do not evaluate their psychological strength, and that is where the gap is. And so where this stemmed from in the creation of the AWQ-10, which is something that I've researched at Citrus Aesthetics in my practice with my patients, is one patient's story. It was the simplest regenerative aesthetic medical treatment, Botox. And after a Botox treatment, this patient called me and said, "I hate my face. Raise your hand if you've ever had excellent clinical outcomes, but complete dissatisfaction in your patient." Has that ever happened to anybody here? So the problem lies in that we are not fully evaluating our patients for their psychological strength. And so what I did is I created the AWQ-10. It's a simple pre-screening treatment tool called the Aesthetic Wellness Questionnaire, and it's an ethical framework for aesthetic and regenerative medicine. So what this does is actually allows us to screen our patients simply but strategically in order to decline treatment when necessary and refer to mental health specialists. So I'm owner of Citrus Aesthetics, which is a regenerative practice in California, as well as Citrus Franchising, and I'm on a mission to create a different kind of aesthetic medical practice where there is always advanced providers, continued education, and also a framework for not only ethics in business, but also ethics in how we evaluate our patients. So with that patient that came in, they had a simple neurotoxin treatment, and she stated her dissatisfaction. I had her come in for a follow-up visit, and clinically, the results were beautiful. There was no adverse outcomes. And so I continued to follow up with her, and for 3 weeks was in 24/7 contact with her because this patient began to experience symptoms like neurologic symptoms, stating that she had loss of vision, feeling that she was having weakness in her face, saying that she was dizzy, both symptoms that I couldn't necessarily evaluate. But I brought her back into my clinic, and with emergency medicine background, she had no actual neurologic deficits or anything that I could clinically diagnose. She went on to have even more extreme symptoms and eventually became suicidal. And I was at a loss because I realized somehow I had done inadvertent harm, but I couldn't find a clinical reason. There was a disconnect, and she was having psychosomatic symptoms only. So this is a question of how do we protect our patients' psychological status? We all, as excellent clinical providers, want great results, safe results, but do we actually protect our patients' psychological status? And how do we go about doing that is the question. So, as all of you know, our industry is booming, and does anyone currently have any kind of psychological evaluation in their practice? That's where the gap lies. So there's a significant vulnerability, and based on the research that I've done at Citrus Aesthetics, 5% of patients come in and they're not psychologically fit to endure aesthetic or surgical treatments, either because of high incidence of BDD or significant life stressors, things like recent financial loss or a recent divorce or a death in the family even. unresolved trauma, sometimes things like sexual and emotional abuse. And all of these factors increase the chances that they will psychologically spiral, meaning that even if your clinical outcomes are excellent, which I expect they are majority of the time, that patient will be dissatisfied with the outcome no matter what. This increases your risk of litigation. It increases actually the cost of that patient to you, so decreases the ROI in your business because you end up spending so much more time with that patient trying to fix something that is psychological when it really could have been prevented. So we all took an oath to do no harm, and the AWQ-10, the Aesthetic Wellness Questionnaire, is one structured protocol and tool that we can all implement easily in order to do no harm. So it seamlessly integrates into the EMR, and it essentially implements a strategic low, moderate, and high risk score for each of the questions, or for each of the patients. Each of those 10 questions is weighted differently based on the severity of that question, influencing the probability that that patient is more at a higher risk of becoming psychologically unstable after treatment. So this allows us to go from a paradigm shift in aesthetic and regenerative medicine to transition the standard consultation model from what to treat to actually whether to treat. And a lot of you may have a business that runs mostly on elective procedures. And your first question is probably, how is this going to affect my business? And I can assure you that I have an extremely successful and profitable, as well as ethical, aesthetic medical clinic. So that 5% of patients, you actually improve your business model by declining care prior to treatment. So those three categories, little risk or the low category. That's when those 10 questions, majority of them are answered with a no. And the medium risk category, so low risk, you move forward with treatment. Those are the patients, the 95 or 93% of patients where we transform their life because through excellent clinical outcomes, we increase their confidence, we increase their ability to approve of their face or the things that they had goals for previously. Those are now addressed. And so that impacts their relationships and it impacts their careers. And you all know what I mean when we're able to transform those patients who are psychologically stable. The two most important categories here with the AWQ-10 are the moderate and the high risk categories. And that moderate or medium risk are those that may have some previous risk factors like sexual or physical abuse, previous history of suicidal ideations, and then recently had some kind of a loss in the family. And that's the group where you postpone treatments. So that group needs to go through, likely if it's a loss in the family, a grieving process. And on average, what I've noted through my research over the years is that this can take anywhere on average between 3 months to 9 months. And so you evaluate that patient again after having referred to mental health specialists. So you must create a referral system first alongside implementing the AWQ-10. The high risk category is the most important category of all. And like I mentioned, it's 5% of your patient population where if you move forward with surgical treatments or non-surgical aesthetic and regenerative treatments, you will inevitably do that patient harm. They will be dissatisfied with your clinical outcomes, higher risk of litigation, and cause you actually a greater financial loss. That high-risk category, we have a really hard discussion with that patient, and we decline treatment before moving forward with anything else. And then refer to the resources that that person actually needs in that moment, because they're coming in with a lot of trouble on the inside and psychologically. We are not their fix in that moment. We all know that. We all have that clinical gestalt and feeling in knowing, but the question is, will you practice medicine ethically and do what's best for your patient by declining care in this high-risk group, utilizing a clinically backed tool like the AWQ-10, and referring to mental health? So the evidence with the study I did at Citrus Aesthetics, that high-risk category, so there was 360 patients that were included, and that high-risk category was approximately 5%, the medium risk 2%. And what this did, by declining that group of patients, it significantly improved my overall patient satisfaction rates, increased patient retention, and allowed for me to actually build long-term trust. Even with those psychologically stable patients who end up seeing the AWQ-10 as part of their pre-treatment consent forms to fill out, that even builds trust, because they understand that I have their best clinical and psychologic interest in mind, and that I'm not a transactional clinic alone, that Citrus is actually an ethical clinic. So there, of course, in this study were friction points, and one of those, the most important and difficult hurdle to overcome, is that conversation you have. So expect for it to take 30 to 60 minutes. And that sounds like so much of a time investment. But believe me when I say it is worth it, because you all are thinking of that patient that has given you that significant amount of trouble and hassle afterward. And you can't explain, and it's so frustrating, why they don't see eye to eye. No adverse clinical outcomes, beautiful results, but no matter what, they will never be satisfied. So what I've learned over the years is that there's a specific approach in conversation, a very strategic yet difficult conversation to have. And what happens with this patient when they came in, fucked up on the inside, emotionally unstable, and hoping that you will be their saving grace, hoping that you will fix how they feel. And so when they get an answer from you that you are actually declining treatment and will not do their treatment, they go through the stages of grief within that 30 to 60 minute conversation. That first step is denial. They deny that they actually have the issues that you know that they do, in denial. The first thing I start off with the patient is discussing that I've implemented the AWQ-10 because of specific patient experiences where I did inadvertent harm. And I know that if I were to move forward with treatment with you today, the same can happen with you. And so I take that conversation very compassionately and very slowly, because they have to work through each and every one of those stages. And now that I've mastered the conversation, I have the ability to teach other providers how to navigate that difficult conversation. But it has to go through that process of those 5 stages of grief. Next, they get angry, sometimes belligerent, sometimes cussing you out, sometimes wanting to leave a negative review. You have to keep them in the room. You have to finish the conversation. Once you get through that stage of anger, they begin to bargain with you. What if I pay you double the price you're asking for? Will you please do my treatment? All I want, triple, quadruple. And you maintain your composure, and you maintain the urge to say yes, because it's not worth it for that patient or for you. The next is depression. Oftentimes the patient will get extremely emotional, very sad, when they begin to realize all of the problems that they have and why they actually walked into your clinic today. And the last is acceptance. And that moment of acceptance, I almost get emotional thinking about it because I've been able to now master that conversation. And in those 5% of patients, when they finally do accept and realize that you as a clinical provider have their best interests and actually know what solution they need, which is mental health specialists, they are incredibly grateful. And that patient may still come back to you in a year, 2 years, 3 years, but you have done the ethically right thing for that patient and also saved yourself litigation risk, patient dissatisfaction rates, all of the above that we try to maintain for our businesses. The other instrument limitation with the AWQ-10 is that it's not an official diagnostic psychiatric screening tool. So my goal is for every one of you to implement the AWQ-10 into your clinical practice and share it with anyone you know who's a clinic owner, provider, because the more information that we gain and the more we collaborate on this, the better we can evolve the aesthetics industry. And so we do have limitations, of course. There's also clinical gestalt involved. A patient may be savvy in a way and answer no when it's actual yes. So at the end of the day, you still need to use your own medical discretion and clinical gestalt. The overall takeaway is that the more practices and providers that implement the AWQ-10, the more we can optimize this protocol and close that gap that I mentioned, because none of you raised your hands that you are doing any psychological screening at all, and that's a significant gap in our field. So, like I mentioned, the vision for this tool is to be able to utilize and implement it globally in every aesthetic regenerative practice, hopefully every surgical clinic as well. Based on my research, there are demonstrable increases in patient satisfaction rates. The most important aspect and the most difficult, like I mentioned, is learning how to navigate that conversation, because what used to happen to me is I would end at that anger stage, and that patient would walk out the door and they'd be pissed and they'd leave a negative review and they would tell all their friends because they didn't navigate through all those stages yet. So I do have training programs on that. I come to clinics one-on-one to train as well, because admittedly, it's easy to access the AWQ-10, to start implementing it into your pre-treatment protocol. It's so simple to score as well, but that conversation is the most difficult aspect. And I'm happy to teach any of you, answer any questions you have, because obviously this presentation isn't long enough to explain fully how to navigate that successfully. So I would love to ask you to join this movement to become a more ethical aesthetic and regenerative provider, facial plastic surgeon, or whatever field you're currently in. This is a QR code. You can scan it with your phones now, and I invite you to do so. You can access the AWQ-10 through this. I also, on the next slide, would love to connect with all of you, because we can all exponentially improve not only clinical outcomes by collaborating, teaching, inspiring, learning from each other, but we can actually move this field in a trajectory where the public trusts what we do. On a global level, we're respected as an actual field of medicine. That would be lovely. And we get best outcomes and lowest rates of doing harm in our patients. Thank you so much.